Hello everyone. First of all, I would like to thank the National Pancreas Foundation for having me here today. It's been an honor. My name is Toss and the full name is actually very long. It is Tossapol Kerdsirichairat. So please feel free to go by Toss because I introduce myself to my patients that way as well. I was born and raised in Bangkok, Thailand. I came here to the United States for a research year in 2010 and I have stayed here since then. I graduated from the Faculty of Medicine, Siraj Hospital, Mahidol University in Bangkok, Thailand. Then I came here for a research year at UCLA. I went on to internal medicine residency program at the University of Minnesota in the Twin Cities for another 3 years. Then I went on to the general gastroenterology training at the University of Michigan in Ann Arbor. And I finalized my last 2 years in advanced endoscopy training at the Johns Hopkins University. I am currently a clinical associate professor and a co-director of the pancreas program at the Geisinger Health System. We approach our complex patients in pancreatic diseases with multidisciplinary approach. We work very closely with our pancreatic surgery team, surgical oncology, pancreatic radiologist, radiation oncologist, as well as oncologists. And not only these providers team, we also work closely with our clinical and research coordinators. I got interested in the pancreas based on two main reasons: the disease itself and also the mentorship I have received. In terms of the disease, I am very interested in pancreatic cancer and pancreatitis. These two disease spectrums share the same phenomenon. That number one, it has a rising incidence over the past few years. And number two, it poses a very significant burden to the patient, the family, and also to the healthcare system. The other part is that the mentorship I have received over the years. I have been fortunate enough to get trained by the leaders in the field. At the University of Minnesota, I was trained by Dr. Marty Freeman. At the University of Michigan Health System, I was well trained by Dr. Grace Elter, Dr. Richard Kwan, and Dr. Michelle Anderson. And at the Johns Hopkins University, which is a major pancreatic center that has specialized itself into the field of the pancreatic cancer. I work with Dr. Mimi Canto, Dr. Mike Goggins, Dr. Ong Ji Shin, Dr. Anne-Marie Lennon, and Dr. Vikesh Singh. These staffs and mentors have inspired me over the years that they have been dedicating to their patients and the field a lot, and I want to be part of that I can contribute to the fields and also the patients one day. I was first introduced to the National Pancreas Foundation by my mentor, Dr. Marty Freeman, and over the years I have joined multiple NPF fellow symposiums. The symposium is very helpful for the fellows because not only that you learn from the leaders in the field, but you get a chance to learn from patients directly who suffered from the disease. And I think the latter part is very important because as a provider for the pancreatic disease, you need to know the patient as a whole. And over the years, the National Pancreas Foundation has become my family. One of my graduations in Baltimore, 3 staffs from the office of the NPF came down to Baltimore to join a small dinner, and we had a great time, and that means a lot to me. At Geisinger, we are very interested in pancreatic cancer because in the state of Pennsylvania, we have high incidence of pancreatic cancer compared to national numbers. At the same time, at Geisinger, we have a long-run project called MyCode, and this project has a simple idea that we want to obtain blood from the general population in a large scale, and we run genes for them for free. And the genes that we run is called the exome sequences. And over the years, we have completed exome sequences from more than 145,000 participants. This is a very rich data that we want to work on for pancreatic cancer because we want to find a true linkage of the genes associated with pancreatic cancer in a large-scale population-based study like this. And we hope that we can comprehend this precision medicine approach to the pancreatic cancer screening program because we want to find an early tumor. The early pancreatic cancer is the key because if you can find it early, it could be curable with a good outcomes, with a good survival, compared to when you find it at the later stage called the metastases that could have a very compromised survival and outcomes. At 5 years, people could survive only less than 9%. And we hope that with this precision medicine approach, one day we can offer genetic tests to the general population and we can filter for those who actually at risk to undergo the pancreatic cancer screening protocol. And this perhaps could improve the outcomes and survival for the pancreatic cancer in the future.